what's going on, everyone? Welcome back to another episode of Med Advice. For anyone who is new to the channel, my name is Jacob and I am getting ready to start my last year of medical school here in Kansas City. If you've liked my videos so far and you want to stay tuned for more medical school content, feel free to subscribe down below so you'll never miss a post. Today we're tackling one of the toughest questions for med students and pre-meds to answer, and that is, what specialty do I want to go into? Deciding what specialty you want to go to in med school is no doubt one of the biggest decisions you'll make and will have a huge impact on the rest of your career. Because of this, it's one of the toughest questions for med students to answer, and it really can give us a lot of anxiety and stress. Now, some med students, pre-med students, or even high school students feel like they know exactly what they want to go into right from the get-go. But it's really hard to tell unless you've gone through med school and had those rotations and those experiences. A lot of people, on the other hand, come in very open-minded and learn what they really enjoy throughout med school. I myself had an idea of what I thought I wanted to go into, but through my experiences completely changed my mind, and now I'm applying for something else this year. So with this video, I wanted to do a deep dive of my experience when it came time to choose my medical specialty, and also lay out a couple things that you can think about either in med school or even in pre-med to point you in the right direction of where you might be interested in for your future specialty. So this first one is probably the most important thing to consider when you're thinking about different medical specialties, but it's kind of tough to gauge unless you're in medical school seeing patients. So this one is all about the level of interaction that you want to have with your future patients. For example, do you want your days to be packed with lots of patients that you've developed relationships through seeing them for the last several years? Or would you rather have a lot of smaller interactions with patients that you may not see that often? Or are you on the other side of the spectrum and you don't want to see patients at all for the rest of your career? Answering these questions can really help you lead yourself down the right path when it comes to choosing a specialty. For instance, if you really love developing long-term relationships with patients, something like internal medicine or family medicine might be great for you because you see the same people throughout several years and you develop those relationships. A lot of smaller interactions where you may not see them that often, emergency medicine could be great, some surgical specialties could be great. If you don't want to see a patient for the rest of your career, lean down the pathway of radiology or pathology because you're not going to have those patient interactions. Going off of the same topic of patients, think about the type of patient that you want to see. Do you love kids? Do you like older people? Do you like people that are generally healthy, or do you like people that will really need your help to get them on the right path? Again, pediatrics is great for people that love children. Geriatrics is great for people that love working with the elderly. If you really want to work with a healthier, more fit patient population, sports medicine might be a way to go. Or if you really want to work with a population that needs you, those long-term relationships to keep them healthy, internal medicine and family medicine are great for that as well. The next major important thing that I want to talk about when choosing your specialty is to look at the personality of the people and the doctors who are in that specialty and see how well that matches your own personality. For instance, are you someone that likes being on the go all the time doing things with your hands? Again, surgery or emergency medicine might be for you in those fast-paced environments. Or do you really enjoy taking your time, sitting down and spending maybe an hour or two with a patient talking about their life story? That might lean you more down the psychiatry route. Are you somebody that likes to think critically about kind of like puzzles and help prevent illnesses in the long term? Internal medicine is great for that, especially in the hospital, dealing with patients with acute problems, and also in the outpatient clinic, dealing with preventative medicine. Now, the next major question to ask yourself to either rule in or rule out a medical specialty is whether or not you want to do procedures. And the common misconception is if you say you like procedures that you have to go into surgery, and that simply isn't the case. There are so many medical specialties out there that allow you to do small and even medium scale procedures without the lifestyle or workload of a surgery life and career. For example, specialties like physical medicine and rehab and sports medicine allow you to do injections for arthritis and other musculoskeletal conditions. Specialties like dermatology can include a lot of biopsy procedures, which can be really interesting, or cyst removal, things like that we see on Dr. Pimple Popper. Interventional cardiologists and radiologists end up doing a lot of small and medium scale procedures. So the rule of thumb is that you don't necessarily have to go into surgery if you like working with your hands, but it's important to think about this question because it will dictate a lot of your workflow, whether you enjoy doing procedures or not. The last major thing that I wanted to talk about when it's time to consider what your medical specialty might be, and this by no means makes it the least important, is your work-life balance. And this is something that is commonly slept on and put on the back burner when it comes time for a lot of students to pick their medical specialty. A really common thought that a lot of people have is that if you're going to take the time and go into medicine and be a doctor, that you should do the most competitive thing that you possibly can with the most surgeries, the most procedures, the most complex patients, the most research, etc. And it's really important to think about the next 5, the next 10, the next 20 years, what do you want your life to look like? Because this is a big thing to consider when you're choosing your medical specialty. A lot of lifestyle outlooks are different based on your specialty. Are you okay with being on call every third or fourth night as a trauma surgeon who's covering the hospital? Are you okay with having to leave a family dinner or function to come in to the hospital and help a patient in need? Or do you want more of the 9 to 5 typical work week with weekends off balance with very little call or no call? These are definitely the important things to consider, and I think not enough people in medical school talk about how important lifestyle is when choosing your medical specialty. A few other lesser important things that you can consider when choosing a specialty are the specialty outlook, how much money you're gonna make, and the length of the residency training or the options for fellowship training. The reason I say these are lesser is because in the next 50 to 60 years, I don't think any specialties are really gonna fade out completely. In terms of money, obviously everybody's going to look at it. Everybody comes out of med school with a lot of loans, and you want to find a way to repay that as quickly as possible, but it shouldn't be a primary or secondary concern when thinking about your specialty, because you want to find something that you're really passionate about and that you can do for the rest of your life and be happy with. Choosing a specialty is in no way an easy decision, and these are just some of the things that you can consider when deciding what you want to end up going into, but I think this is definitely a good start. It handles a lot of the big questions that you need to answer so that you can kind of narrow down what sort of fields that you would be potentially interested in when it comes time to apply. To give you guys some perspective and an example of how a student might come to a specialty decision, I'll give you guys kind of my decision and thought process using the outline that I just gave you. So I knew that I loved working with patients. I want to see patients every day. I want to establish these long-term connections with patients throughout many years, and I want to watch them get better. So that was something that really helped me determine what I wanted to get into. In terms of the types of patients that I want to work with, I definitely want to work with people that genuinely need my help, and I want to join them on their journey to get them back to the best level of function and quality of life that we can possibly give them. In terms of my personality, I am somebody that likes to be on the move, but I also do like to take the time to sit down and talk with a patient, maybe not for 1 or 2 hours, but certainly for a good 20-30 minutes to kind of get their story and get to know them a little bit better during that visit. When it came to deciding procedural versus not procedural, I definitely do like procedures. I want to be able to do those for my career, but I don't think I loved the OR enough to go down the surgery route. I didn't think it was as good of a fit for me as more of those smaller scale procedures like possibly injections or biopsies or reductions of fractures and things like that. And finally, on the list of the major things that I considered, in terms of work-life balance, I worked hard in medical school. I know I'm going to work hard in residency and for the rest of my career, but I knew down the line that I did want to have a family. I wanted to be able to spend time with that family and enjoy the things that I love about life. And I wanted to make sure that I had plenty of time to do that in addition to my work. So I wanted a specialty that did have a good work-life balance so that I would be able to do that. And with all that in mind, for my medical specialty, I chose physical medicine and rehab. This is something I'm really passionate about. It's going to allow me to see the types of patients that I want to see and, develop those long-lasting relationships that I'm looking forward to. I think it really fits my personality, and I'm going to get to do procedures. And also it does offer a great work-life balance, which is something I'm looking forward to and excited about. If you aren't totally sure what you want to go into, do not panic. I didn't figure out that I was interested in PM&R until almost the end of my 3rd year of medical school, when I was doing all of my rotations. So don't panic. You will get experience. You'll go on your rotations, and you will really discover what you're passionate for and what you have an interest for. If you're early in med school, or if you're even in pre-med or high school thinking about going into medicine, it's definitely a great idea to do some research, see if you can find a doctor to shadow to really get an idea of what their day-to-day life is going to be like, because with hard work and dedication, you're going to get there too, and it's great to have that experience to build off on and really get an insight of what your day-to-day is going to be like in the future. But I'm interested in what you guys are thinking. If you want to go into a certain specialty, or you have any other questions about how I made my decision, feel free to drop a comment below. Really hope you guys enjoyed this episode of MedVice, and as always, I'll see you next time.